Hi, Dr. Keener. My name is Carrie Jones, and this is another slideshow for the tools that I used for my practicum that I am presenting to you for my capstone. So this is how my project was essentially created. So a slideshow of what simulation is and its benefits. The scenarios, I created three scenarios, one based on IV, wound care and filament testing. So through weeks of observation in the clinic with the nurses, I observed where, what skills were lacking, how I can boost confidence on how to do these skills, and how to make things flow a little bit better in the clinic and have better patient outcomes so that there's not so much repeated patients coming in, for example, like wound care. If we can correctly identify the staging of the wounds due to lack of information presented on the physician referrals, we can look at staging and we can look at other health issues and how to collaborate with other healthcare professionals to properly address the wounds so that there isn't repeated visits or reducing the visits. For some of the patients, I use pre and post surveys before and after simulation. Um, documentation checklist. So what I did with that is I just kind of gave them tidbits on how to document so that it flows and enough information is in there for the next nurse to see. Questions to the stakeholders, both Samantha and Connie, implementation slides. So I provided an implementation slide to the stakeholder, Samantha, how to incorporate my project for future training sessions, um, an IV education with Samantha. I throughout my observation, I noticed that IV was one of the biggest, IV insertion was one of the biggest issues. So Samantha, I shadowed her for 2 days, and one of the days we created an IV workshop for some of the nurses. We had a great turnout, and you'll see some of the photos there, an education session with Ontario Health at Home. So that was my second shadowing with Samantha. And we looked at different techniques for wound healing, which was like almost like a TENS machine that provided electrodes to the actual wound area to increase blood flow. And essentially the goal was to help healing. So I introduced what simulation was. There's two types, there's low and high. So for this particular practicum, we use low validity, which was a mannequin arm and a foot. I also started off my practicum by introducing what simulation is. So I set up a presentation with some of the nurse managers and therapy leaders and explain what the benefits of simulation is. Benefits to simulation, we looked at refining skills, so bridging the gap between theory and practical for some of the nurses in the clinic, letting them know it's a safe, controlled environment for them to work in, replicating real world scenarios. So I created three scenarios, one for IV, one for wound care, one for filament testing. Unfortunately, within the clinic, filament testing wasn't being done at all just because there was no education, no training around it. Some of the nurses didn't even know what it was. So because I am an advanced diabetic foot care nurse, that actually came a little bit easy for me to educate them and show them what filament testing actually is. And then, creating the simulation and handling complex situations. Um, so this was one of the things that I presented. So I provided an IV scenario, which I also submitted to you in week 5. Here's the diabetic filament testing scenario and then the wound care scenario. So this is actually one of the stations that I created here. So this is the foot that I used for wound care and filament testing. Excuse me. So I set this up, and this is how I would set it up for nurses coming in. So they would look at the back picture and tell me, pick one of the wounds on the foot and tell me what staging this wound is, and then to dress it appropriately with material. So I purposely left out some of materials here so that they can tell me what they need to get from, you know, their storage that has the if it's honey, TheraHoney, if it's Idazorb, excuse me, for example, if the wound had slough, TheraHoney and Idazorb would be the correct application for this particular wound. So checklist was just based off of that, just something simple to have them follow. This is one of the stakeholders I interviewed. I asked each stakeholder 3 questions. There was 2 stakeholders. Connie's the CEO, and I provided her the 3 questions that I asked her as well. Samantha is another stakeholder, especially she's also the director of education in the clinic. She oversees more than one clinic. I think there's about 6 of them. Samantha is who I shadowed as well, and we created the IV workshop. And then I presented the implementation to my project to her as well. Um, she was great. She was amazing to shadow and to create things with, like we did the workshop. Educational poster was used to provide just simple education and benefits and costs to simulation. The first slideshow that I presented to the nurse managers and therapy leaders was just talking about budgeting, cost, finance, low validity mannequins, and what it can do um, for their community clinic for nurses, and extending it out even for therapy. For example, doing range of motion exercise, if there's a low validity mannequin that we, can click if you went too far pushing a patient's arm up, or what points it will beep if it has the correct points that you're using range of motion in, stuff like that. Excuse me. IV education. This is a workshop in one of my shadowings with Samantha. The workshop we created, we had a great turnout of nurses. This is the arm that I used as well to train nurses as well in the clinic. Also, we had a volunteer individual that allowed nurses to poke him so that they get the exact feeling of skin, putting the tourniquet on, feeling for the vein, and then inserting the needle. So it was a really, really, really successful workshop that we did. And then the conclusion to my practicum. So what the purpose is to encourage implementation of simulation as part of Closing the Gap initiative at the end of the practicum. So in conclusion, I would establish a simulation lab to develop scenarios based on my weeks of observation with the nurses, focusing on, like I said, IV insertion, wound care, and filament testing, which proved to be successful through my teleconferences with my professor, Dr. Munch at the time, and my preceptor. They helped me to narrow down my project a lot, and my focus, because high validity mannequins is what I had seen in hospital, in acute care setting. Usually in hospitals, it's not, simulation isn't used that much. It's only used for ICU in Canada, as well as like code calls. But for, in school, I've had one session that I could recall of a simulation environment. It wasn't enough to help. I think it needs to be implemented more in schools, to better prepare nurses in the workforce, and even using low validity in the workforce to help nurses regain that confidence. Because if you think about it, in hospitals, you're really focused on one unit. So I worked on neurosurgery and I knew neurosurgery, but if you put me in pediatrics, I know the basics of pediatrics, but it's different skills for different units and different levels of nursing. So I think simulation is great to focus on and help build those skills and confidence as well. Thank you, Dr. Keener, for listening to my presentation.